Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Weening.
And I'm Dr. Paul Zalzal.
And I'm Dr. Sandeep Sharma.
So we have a guest today. Dr. Sharma is an obstetrician gynecologist. Is that how you guys go by?
Absolutely.
You got a lot of cool names. You got
Big long word.
OBGYN, obs-gyne. We just have like, I'm your orthopedic surgeon.
That's right. And on today's topic, we're going to talk about fibroids, which is a very common problem. Dr. Sharma is going to enlighten us a little bit. So Cindy, what's a fibroid?
Well, fibroid's a benign muscle growth that occurs on the uterus. Very common. Up to a quarter of patients we'll see from early adulthood to menopause will have them. And that's the easiest description I'd give you.
Okay. So how does someone present if they have fibroid? Like, what are some of the symptoms they might have?
So that's a good question. So a lot of fibroids are coincidental findings. Patients really have no symptoms, but as they get larger and based on their location, women can start to experience menstrual pain, excessive flow, difficulties with intercourse, bladder problems, and sometimes fertility issues as well.
Okay, so that's lots of bleeding, pain, and other dysfunction. So they show up, you do a history, so they tell you about all that stuff. Physical exam, can you find it through the abdomen? Can you feel a fibroid?
Absolutely, yeah. Women will sometimes come in saying they feel pregnant, they feel like their stomach's getting bigger, their pants are getting tighter. Women will sometimes say that it doesn't feel right, there's a lot more pressure in their pelvis.
Okay.
So there's a lot of symptoms, and obviously the heavy flow.
Sure.
Okay, so someone has, they've come in with the symptoms that you described. You made the diagnosis,
Yep.
Or is the diagnosis done on physical examination? Or
No, absolutely not. So there's lots of ways to try to confirm the diagnosis. The easiest, most cost-effective way is to have the doctor order an ultrasound.
So it's not an X-ray?
No, not an X-ray, no X-ray. So we'll use ultrasounds, and we'll sometimes use special ultrasounds where we inject a little saline to try to delineate that fibroid, and then MRIs are also becoming much more common for diagnosing this.
Okay, so like everything, now we've done a history, a physical examination, some investigations.
Correct.
You just described the ultrasound and the MRI. Now we have the diagnosis of fibroid?
Pretty much. I mean, most gynecologists would comfortably be able to manage going forward at that point.
And so then in orthopedics, we always talk about treatment options, and usually it falls into non-operative and operative treatment strategies. Would that be the same for a fibroid?
Absolutely. So some of the options include simply just wait, watch, and see by serial ultrasounds and symptoms. We can use medications, and the medications are targeted to try to treat the symptoms, and sometimes now we can treat directly the fibroids. And then we get into non-surgical but interventional type treatment. So we now can try to knock out the blood flow using our radiologists here in our hospital.
Okay.
And then the last option is surgery.
And then so at surgery, are you cutting the fibroid out, or?
So then we have to discuss with the patient what their goals are. So is it to preserve the uterus, or are they done with childbearing? Is fertility the problem? The location of the fibroid dictates the type of surgery. Okay. So it is more complex than just simply operate or not operate. We really have to tailor it to the patient's needs and the fibroid symptoms.
Okay. Wow. With us, if it's broken, we put it in a cast.
Yeah, it's not that easy for us.
Okay, so let's say you've gone through the treatment options with someone, and they've decided, okay, I want, or do you jump right into surgery, or is it usually a trial of the conservative measures first?
I think all of it comes down again to the severity of the symptoms. If someone's bleeding severely, where you really need to get them bleeding controlled before you can even consider surgery, then we would use medications or alternate means to make them safer for planning a surgery. But there are times where surgery is absolutely necessary and we need to expedite.
Okay. So surgery, whenever we talk about surgery, we always talk about risks versus benefits. So can you just give us a touch on some of the risks?
Absolutely. So we are working on the uterus, which is very close to the bowel, the bladder, and some major blood vessels. So there's risks of injury to those structures, although it is relatively uncommon. There's risks of infection. And pelvic surgeries always carry a small risk of getting a blood clot in your legs, and that can be a serious problem. So we take all those risks very seriously when we approach this. And there is loss of fertility. If someone's trying to preserve the uterus, not having a baby has to be a very clear discussion with them as well.
Obviously. Generally speaking, Sandy, would you say that treatment for fibroids is it successful, or do people think, oh, I got a fibroid, I'm going to be stuck with this forever, this is a horrible diagnosis?
Absolutely successful. Based on what the patient's needs are, you need to have a good goal, and then you work with that goal. If the goal is to just treat the symptoms, we can treat the symptoms. If it's to get rid of the fibroids permanently, to relieve the pressure, or move forward and not have to worry about them again, a hysterectomy is a curable operation for them.
Awesome.
You know, I had a lot of respect and awe for what you do, but now I have even more. I mean, something like a fibroid, which is a benign thing, has a very complicated treatment algorithm, and I really appreciate the stuff you do. We don't get to rotate a lot through obs-gyn.
During medical school, I think maybe 6 weeks, caught a couple babies, and
That's it.
you know.
And your stuff is urgent too.
Yes.
It's like when you get called to emerge, it's like the baby's coming, come here now.
Yeah, they have good sneakers.
Yeah. With us, it's like the bone is broken. It'll still be broken in an hour when I
That's
get there.
right.
True that.
So if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
And we'd like to thank Dr. Sharma for joining us today. That was really great.
Thanks, guys.
Thank you very
Thanks, guys.
much.
Thanks,
Thank you
Sam.
very much, guys.
See you next time.